AFR Talk.
Hi, and welcome back to Focal Point, AFR Talk. Brian Fisher is my name. 888-589-8840. Number to call, 888-589-8840. Let's grab a call from Dan in Richmond, Virginia. Dan, thanks for calling and thanks for waiting. What's on your mind?
I just want to throw in my 2 cents worth.
Yes, sir.
Years ago, we were required to buy automobile insurance. A portion of my insurance premium is to cover uninsured motorists. We're now faced with a similar situation with health care, where the government wants to force me to buy their kind of health insurance, a portion of which will be to cover those who choose not to insure themselves. It's only a matter of time, I think, before the government decides that my real estate insurance will be the same. Because if I buy Jupiter Insurance and they have offices and policies nationwide and they suffer a catastrophic loss like the tornadoes in Illinois, I'm going to have to contribute to the Jupiter Insurance Company enough money to cover their losses there. One of these days, we're just going to have one big insurance policy that covers all of them. Yeah. And I'll listen offline.
All right. I appreciate that, Dan. And, you know, there isn't any reason why. I mean, you think you compare what we're trying to do, what Obama's trying to do with health insurance, with any other kind of insurance out on the market, it's just ludicrous. In fact, what I've suggested is if you want to extend affordable health care to the maximum number of people, including poor people, then get the government out of health care altogether. Because what drives up the cost of health care is, and you have this in individual states. I dealt with this when I was working in the legislature in my home state of Idaho. You have insurance commissioners that regulate health insurance for every individual state. And you have all these lobbyists that represent different parts of the health industry, and they go and they lobby that health commissioner and they lobby the legislature. You've got to include our procedure in the mandatory treatments that are covered under state health policy. And so they'll get it done. These lobbyists get paid big money to go in there and convince the legislatures and the state health insurance commissioners to mandate, I mean, it might be mental health treatment, it might be substance abuse. It might be chiropractic. It might be acupuncture. Who knows? But they will get it as a matter of state insurance policy that every policy that's sold in this state has to offer this kind of coverage. Now, usually it's kind of at a manageable level, but in my mind, there shouldn't be anything on that list. You know, we ought to allow the consumer to decide what kind of protections he wants to pay for in his health care bill. You know, when Debbie and I were back in Idaho, and we had a catastrophic plan. So we had a major health event, we were covered. But we were out of pocket for the first $7,500. It didn't matter what the expense was. We had to go get a hangnail treated. It was out of pocket. We went to buy a prescription. It was out of pocket. Went to the eye doctor, it was out of pocket. Went to the dentist, it was out of pocket until we got to $7,500. And so that if you had a major event like a cancer or something like that, you were covered. That's what a catastrophic policy is all about. And I don't remember what the details were in terms of what our health insurance policy would and would not cover. But if you get government mandates out of that altogether, say we are not going to have any government mandates at the state level or the federal level. Remember, what makes Obamacare so expensive is Obama has dictated that every insurance policy that's sold in America must have maternity coverage. Well, Debbie and I don't need maternity coverage. Young single guy doesn't need a maternity coverage. Couple in their 50s probably doesn't need maternity coverage. The number of people that don't need maternity coverage is staggering, and yet every single one of them is being forced to pay for a product that they never, ever will use. It will be biologically impossible for them to ever need that product. You also have to provide pediatric, dental, and vision care. Again, that is a a treatment that Debbie and I will never, ever use. Any couple in their 50s, never in a million years. It's biologically impossible for them to ever, but they have to pay for it. What does that do? It drives up the cost of insurance. So get government out of there altogether. Just clear them out. No mandates, no government regulation. This all can be done by private firms. I mean, consumer reports. How many people go to Consumer Reports to figure out what to buy? That's an entirely private deal. No government money, no industry money. But that's where people go. It's a private thing, and people go there to find out what kind of product. You can have the same exact thing for health insurance companies. Consumer Reports, I'm sure, would be happy to do an entire edition just on health insurance companies and how trustworthy they are, what their business practices are. So just get government out of there altogether and let insurance companies offer whatever insurance products they want to offer, and let the American people buy whatever insurance products they want to buy. You know, when you go, you buy any piece of electronic equipment, they will always try to sell you some sort of a warranty program, right? 1 or 2 years, guaranteed labor, guaranteed parts, and all that. And then you decide, do I want that kind of protection, or do I think this is either a product that's made well enough, I don't need it, I'm banking on the fact that this is a good manufacturer, it's a good product, I'm not going to need it, or what? But anyway, it's your decision. You decide what kind of insurance you want to pay for that particular product. And we trust the American people to make an intelligent decision with every single one of those purchases. No reason why we cannot do the same thing with healthcare. And if you did that, you got government mandates and government regulation completely out of the health insurance market. The cost of health insurance would come down like that. It would come down tomorrow. And I'll tell you why. Because health insurance companies would you could do it today. If you repealed Obamacare today, if you could just wipe that thing off the books, tomorrow, I will guarantee you, tomorrow, health insurance companies would be out with products on the individual market and the employer market that would be catastrophic plans. They would be low premium, they would be high deductible, they would cover you in case of that bankruptcy-ending illness that President Obama kept trying to frighten people about. That's how we spooked people into Obamacare. You are one illness away from being bankrupt. Well, not if you have a catastrophic plan. And these are simple policies. They're simple to write. They're simple to issue. They're inexpensive to purchase. They would be enormously popular. And those would come on the market like sunflowers tomorrow. The cost of insurance coverage would come way down. The cost of health care would come down. You know why? Because people would realize they got to start taking better care of themselves. And they would ask themselves, look, do I really need to go to the doctor? Because I'm going to be out of pocket. I'm going to be completely out of pocket on this doctor's visit. I don't have a copay I can count on. I'm out of pocket. Do I really need to go? And doctors, and there are a lot of doctors now that are going with basically cash and carry. It's called concierge practice, where they're going cash only, cash and carry, no insurance. You go in there, you pay, and they can do a doctor's visit for about a third of what they charge when insurance is involved. So it's a third less expensive for a lot of procedures, including some surgeries. You can get some surgeries that be $15,000, $17,000, and you offer the surgeon, look, I will pay you cash. Let's bypass all the insurance rigmarole. I will pay you cash. What can you do this surgery for? You can get the cost down to 20 to 40% of what it would be with a third-party payer involved. So the cost of insurance, the cost of health care would drop dramatically, and the cost of health insurance. So that's my solution. Just get the government out of the health insurance business altogether. Get them out. No mandates, no regulation. Let health insurance companies offer whatever product they want. Let the American people buy whatever product they want. And everybody will be much, much happier, and it will be far, far less expensive. And you'll have health insurance that poor people can afford. It brings the cost of health insurance down to where people of modest means can afford the coverage. Let's go to the phones. Let's go to Ricky, Baton Rouge, Louisiana. Ricky, welcome. What's on your mind?
Thank you, Brian. Yes, I want to offer irrefutable proof of what I'm about to say cannot be argued against. It's just basically fact.
Okay.
Okay, do you know why Obama can make law whenever he feels like it or change law without Congress?
All right, I'm waiting to hear.
I've been trying to prove this point for 2 years on you and point of view, and y'all argue against me. but you can't. He's an illegitimate African dictator from Kenya, so he don't go by laws because he makes the laws. A dictator makes their own laws. And what Obama's doing now, he's doing just as any dictator would do. He's making the law like he wants to. Only a president of the United States is bound by the Constitution, but Obama's not the president. He's an African dictator, and so he makes the law as he chooses. I'm going to let you comment.
All right, well, listen, I don't think, Ricky, you'd get much argument from, the people that I've been reading stories here today about how unlawful his fix was last Thursday, unconstitutional, illegal. And, it is the kind of thing that a dictator would do. In fact, I've got a piece here from Andy McCarthy. Excuse my vote. I'm still a little bit raspy from my sickness from last week. Just kind of a head cold is what's left. But anyway, Mark Stein, the incomparable Mark Stein, has a lengthy piece basically making the same point that you're making, Ricky. He's not saying he's an African dictator, but he's saying this is how a dictator operates. Which is not, a dictator is not somebody that's bound by the law or bound by any kind of constitution. His only restraint is his own fevered imagination. And Mark Stein here talks about people that say, well, you can't make an omelet without breaking a few eggs. And what Stein says is what Obama's talking about here with this imperial edict that you can keep your insurance if you want, is he's the first one to order that his omelet be unscrambled and the eggs be put back in their original shells. And then he goes back to the time of Marie Antoinette, who was informed that the peasantry could no longer afford bread, is alleged to have responded, "Let them eat cake." There is no evidence these words ever passed her lips, but certainly no one ever accused her of saying, if you like your cake, you can keep your cake, and then having to walk it back with. What we are also discovering is that cake is complicated to buy. So again, Stein talking about the fact that he is just basically exercising dictatorial powers. And he says, look, when President Obama said that he was going to fundamentally transform America, what he didn't tell us is the definition of fundamentally transformed is wrecked beyond repair. Focal Point AFR Talk, back in 2. Stay with us.
Hello, my name is Layla Allison, and I was born and raised in Bosnia. When I was a child, our country was at war, and our family was so poor that we barely had enough to eat. At that time, I just had one little notebook and one pencil. I had to walk 5 miles to school in very old sneakers that were literally falling apart on my feet. But one snowy day, when I went to school, I received a shoebox gift from Operation Christmas Child, a project of Samaritan's Purse. When I opened it, I thought I was dreaming. The box had candy, school supplies, and even shoes. I felt blessed for the first time in my life. And it was through that gift that I first learned about Jesus Christ. This year, you too can pack a shoebox and bring smiles and joy to a needy child.
Visit SamaritansPurse.org or call 800-809-3882 and get involved with Operation Christmas Child today. 800-809-3882.
Here's Dan Celia with today's Stewardship Moment.
There are 4 attitudes we can take as it pertains to God's will for our stewardship. We can say no to God, or we can say perhaps, or we can say someday, or we can say yes to God. Though the first 3 may cause us some conflict, we can rest assured that when we say yes to God, all conflict will cease. Your work will take on a dignity